Hi, my name is Dr. Tebyanian. Let me show you what today is all about. Impacted wisdom teeth out under sedation. This is our most routine procedure we perform. So we just finished the first case of the day, which was removal of 4 impacted wisdom teeth. It went very well. It took me around 20 minutes of surgery. And now patients will recover and be in our recovery room. And then when more or less back to normal, they can walk, he will leave the office. And next, we will have a couple of implant placement surgeries that you can see. So this case, we had this gentleman who, because of unknown reason for osteoporosis, his doctor prescribed Fosamax for him. And although he took it for a very short period of time, less than a year, he started developing a spontaneous osteonecrosis around the bone tuberosity we call tori in the mandible. And we had to go and remove that, stop taking Fosamax. And the complication of this kind of medication, when it happens, it can be very devastating. The bone will die around areas that can sustain trauma, and more bone will die. He's in his healing phase. Today there was like a small sharp edges of the bone that was coming out, and we just removed it. But I will go over what osteonecrosis of the jaw is and how medication like Prolia, Reclast, or any other medication that can change the bone biology can affect the jawbone in adverse ways. That's it.
Smooth.
If it keeps happening, I have to really do the whole thing. I have to it's just like this little thing is not going to do it. I just have to go remove the entire tori all the way, even these and stuff. I just have to just shave them all up. So right now it looks good. Let me see the upper. Better.
Yeah.
If it doesn't happen, we don't need to do anything. But if just more pieces gonna come, we just need to do just the whole thing again.
All right.
All right.
See him back.
And now it's a little break time. So we're gonna make ourselves nice teeth. The next patient is just a follow-up 2 weeks after wisdom teeth extraction. We will see how he does and how is the healing process. That was everything.
Good.
No issues?
No, just a little soreness in the jaw muscles, but that's about it. Everything else seems fine.
So try to stretch your mouth open as big as you can many times per day. And as you stretch the muscle, all those tenderness will go away.
Okay.
See? Beautiful. The sockets of the bottom are still open, so make sure you use that irrigation syringe to keep it clean. Probably another 10 days will all be closed, but until then, every time you eat, just go immediately and flush it out. They're very clean. They look very good.
Cool.
They will just close, and still no chips and popcorn for another week.
Okay.
All right. That's it.
For all crunchy foods, or just...
Yeah, since it's open, maybe just take it easy on that.
Okay.
But after a week, you can gradually go back.
Okay.
All right, very good. So we have one of our patients canceled, so we have a little bit time. So we decided to do some educational videos. Patient had an implant placed here which failed, but because it was very close to the sinus, there was a fistula formed between the sinus and the bone, and she sustained a significant amount of bone loss. So today procedure, we corrected, removed the fistula and repaired the sinus so there is complete closure, and add bone into the sinus and out of the sinus to regenerate the bone and completely seal the sinus. As you can see, the sinus is very low, and slightly here there is a malformed bone that is a cause of a sinus communication right here, as you see. So today we basically repaired the sinus perforation and fistula. We cut the fistula out, and we did bone grafting so that our sinus will completely regenerate. And in the future, with proper bone grafting, we will be able to place another dental implant here. This case here, we did an extraction of a tooth that was broken around 4 months ago, and we bone grafted. As you see, this this tooth was fractured, and there was a large cyst developed inside that chewed the bone away. So we removed it and put fresh bone graft in. Now 4 months later, here we are. As you see, the bone has completely healed and is ready for implant placement. So now we can go ahead. Our foundation again is great. Our bone looks good, and we will place a dental implant here, and this tooth will come back to life again. And that was the day in the life of our day-to-day procedures in our office. Subscribe to see more videos like this.